meeting. Cool. So I'm Mary McIntyre. I am the chair of the Albemarle County Department of Social Services Advisory Board. I'm a teacher at the newly named Journey Middle School, wearing my new school shirt today. And I'm in my new classroom, so I'm hoping my internet is better in here than it was in my old classroom. So how about Amy, you go next.
Hey there, I'm Amy Laufer and I represent Ravenna District. Glad to see everybody again. Maybe Willie Mae, you want to go next?
Hi everyone, I'm Willie Mae Gray, community health worker for Blue Ridge Health District and work out in Albemarle County.
I'm Natalie Dietert. I'm an instructor at TJACE at PBCC. I teach ESL and workplace skills, and I've been on the board since March, I guess. So.
I'm Sarah Harris. I'm from the Whitehall District.
I'm Kaki Dimick. I'm the Director of Social Services.
I'm Mary Stebbins. I'm Deputy Director of Social Services.
I'm Wanda Horman. I'm Assistant Director.
I'm Alice Micklem, the other Assistant Director.
Lisa.
And Lisa.
Lisa.
I'm Lisa. I'm the one that sends you all the annoying emails.
And Mary's cat. What's your cat's name?
Calypso.
Excellent.
Yes.
Make sure we get that in the record. In case anyone watches this video or the recording later on. So we have minutes from the June meeting that we need to approve still. So hopefully everyone had a chance to review the notes from the June meeting. Does anyone have any suggestions of changes or issues that you saw? I did notice in the attendance at the top, Lisa, that it had Kaki listed twice. So we could just delete one of those. So if there are no suggested changes, we just need a motion to approve and a second, and then we'll vote on that.
I make a motion to approve the minutes as written.
I second the motion to approve the minutes.
Thank you.
Who seconded?
Natalie.
Okay.
Okay, everyone in favor of approving the minutes, either raise your hand or give a thumbs up or. Yes, I think that's everybody. All right, so we will move on to business from the director, informational items. Kaki, did you want to talk about July and August, or do you want us to just read July to not talk about it and skip to August? I don't know what you want to do.
I'm happy to just do some highlights. I think all of my highlights actually come from August, but and then we're happy, of course, to take questions about both. A couple of things I wanted to highlight. One, because it's such a great opportunity and project, and also because it was kind of a Herculean task for us, is that our new HR office had a mandate when they first got started to do a class and compensation study. And so that means a lot to a lot of different people, and their focus was on making sure that we are as competitive in terms of our salaries in the county as we can be, particularly now that telework is possible. We certainly, I think I've shared with the board that we've lost employees who are able to work in another jurisdiction for significantly higher amounts of money and not have to move to a new community. And so now we're competing with a broader group than we otherwise would. And that's certainly true for other departments in the county as well. And so The hope was that this class and comp study would get underway and provide us with relevant information to influence the fiscal year 24 budget process. So we're anticipating the results sometime in November, December that would help us in creating our collective budgets. And so in order to prepare for that, we were asked, I think rather casually, to revise every job description we have and to have every employee have the opportunity to weigh in on those job descriptions. And so, as you might imagine, for an institution like us, job descriptions have been built around sort of unique task collections of tasks and not around sort of big global, like 8 or 10 big points that would lead to some economy of scale, like categories of job descriptions. And so this task took us quite a while, and grateful for Mary Stebbins in her willingness to look at every single one of those job descriptions for consistency and to make sure that we were meeting the expectations of the HR office, but also creating some opportunity for us as well in terms of our future recruiting. So that I think they were due on Friday of last week. And so that's been a lot of our summer has been working on that. And so the assistant directors and supervisors and managers all wrangled staff to try to get those job descriptions revised. And then Mary reviewed every single one of them. So that's something I just wanted to, it's one sort of line, but it represents a huge body of work. So I want to call it out. The other is the Septic to Sewer project, which is funded by ARPA money, which is the American Rescue Plan Act, and is some of the second round of COVID related funds. And the county designated $1 million for this project and identified 250 households in the county who are on septic now and are close enough to sewer to be connected. And so the idea is to contract out to connect as many people who are on septic to sewer lines as we can, whether that's through deep 100% cost coverage or deep subsidies or incentives to get folks on board with a combination of goals. One is around poverty amelioration for those folks who cannot afford to pump out or keep their septic tanks in working order. And then environmental effects as well. So our idea would be to concentrate our efforts around endangered streams, where the streams are endangered for high rates of nitrogen. And then also, of course, public health concerns. So it's kind of a cool project that's working quietly in the background, but I think it has some pretty profound potential impact for this community. And so I wanted to call it out. And then we had a self-sufficiency team did a childcare fair with the intent this last weekend with the intent to try to provide as much information and facility for people who wanted to go to open childcare centers or private childcare operations, because we have such a lack of affordable childcare in our community. And so their efforts, they had 8 or 9 people who are deeply interested in creating childcare programs. And so that was well worth those efforts. And then on a more somber note, less optimistic note than those 3, our foster care unit continues to be understaffed and overworked in a pretty significant way. And it's just an important thing to note that as often as we'd like to be prospective and grow and think about best practice and to do all those things, we if we can't meet our sort of baseline requirements, we're stymied our ability to do that. So anyway. That's all I have. Thank you. I don't know if Mary or Alice or Wanda wanted to call something out from those.
Can I ask a question?
Yes, now would be a great time.
What can we do to help with the staffing situation in the foster care unit? Like what can like a community member do to either help or advocate or provide support or anything?
I mean, we have the units, we have positions that are funded that need to be filled. And so it really is getting the word out to folks. And we've had in the last, I certainly will ask Alice and Mary if they want to share something on that front, if there's something that some way to get the word out. It is tricky for us. It has been tricky for us during the pandemic, as with everyone else, that normally we would get 80 applications for something, and now we're getting 3 or 4. And that seems to be something that's happening to a lot of folks. So there's some mild comfort in that it's not just us, but it's not a whole lot of comfort, honestly, the foster care unit. So I think it is really getting the word out to folks. And so if you see something on our, on the Albemarle County HR page or on and that you just forward it on to people that you think might be interested, I think that sort of individual work has probably got better results than the other things. But Mary, Alice, is just something I'm not thinking of that would be a good idea to get the word out for folks?
Well, this is not direct, but workers would find it helpful, which might help us retain staff, and that is we are in tremendous need of additional local foster homes. So anything anyone can do to encourage exploration of that with friends and other folks with wonderful homes to provide. We were both challenged with having kids, placed well outside the area, as well as we have occasions where we have no placement, and so staff have to stay around the clock with them, and that's pretty exhausting work when a child needs two staff 24/7, either at the agency or a hotel or Airbnb. So we really need local homes, and having more of those would help reduce some stress. The other thing I would say, when Keki rightly notes, the pandemic has hit us, lots of industries hard, and child welfare has for years a well-documented national average of 18 months between a caseworker's first case and their last one. So even before the pandemic, it was a tough environment to get staff, and now it is all the more so. And so in my mind, what would help, and that's, it's in the last what a community member can do. And but when I look at some of our local job ads, I'm seeing where UVA is starting to offer big signing bonuses of 5 or significant money. And I think we've never had to do that because Albemarle County is otherwise wonderful place to work in a lot of ways. But I think the environment shifting, and our methods to attract and retain quality people, whether it's signing bonuses and retention bonuses. I think that's, in my humble opinion, I'm not necessarily authorized to say, I think all those things are very much needed.
I completely agree. I think we have repeatedly, internally and externally, and I know we're not the only agency doing it, asking for flexibility around some of those payroll tools that other sort of usually private agencies have the capacity to provide. And while law enforcement, sort of public safety, has some opportunity for signing bonuses, those kinds of things, we haven't quite gotten there. And honestly, the focus has been on the class and comp study, sort of getting that done before we talk about what those flexible tools are. But we certainly will keep pushing for that. And for your conversations with board members, the board has made it pretty clear that they expect staff or workforce stabilization, I guess is the way they've framed it, to be part of the strategic plan for this, that they're going to be engaged in this fall. A pretty big part of that. And I imagine these kinds of flexible tools will be part of that. But if they haven't thought of them, then you might suggest them.
Is there some way we could get links to the job ads, and also links for people if they're interested and are considering, would like more information about being a foster parent?
Sure, we can send you both.
I'd be glad to send them out into my circle, who knows a lot of other people. It would be a ripple effect. It would be great to have that.
Absolutely, thank you.
Also, I don't know if this is even a thing, but I remember in the last school board meeting, it was mentioned by one of the assistant superintendents that because of the shortage of special education teachers, that they are now investigating hiring contractors, private contractors. So like they technically wouldn't be the school division's employee. And I think that gives them possibly then some leeway in the amount of pay and benefits that they're allowed to pay them. And while that set off some alarm bells for me, because I don't necessarily want a teacher in the classroom next to me to be a private contractor and to be making more money than me when I've been working for the county for so long. We're starting to get in desperate times because we have openings that just people are not applying for, and these are legally mandated services we have to provide to children. So is that a thing in social work, for instance, or caseworkers?
Well, we certainly have temp staff, part-time test staff and temp staff, and we make good use of them in all of these areas. And many times it's folks who used to work here, including right now, Phyllis Savitas, who is filling in, helping the foster care unit. So, so yeah, and again, like you and like the schools, it does provide us with some flexibility for the hiring and pay rates, but not necessarily for long-term good, right? Just like
Does anyone else have any questions about, it does not have to be that informational item, it could be anything else from the list?
I was just wondering, out of curiosity, how many people are you targeting for the septic to sewer?
Gosh, that's such a good question. We have this 250 folks who are eligible just based on the fact that they're on septic and near a sewer line. And so we're now going to overlay some income qualification information and then endangered stream information onto it to see where our clusters might be. Because it certainly would be good use of our money to do some economy of scale, like in a neighborhood where there's a high concentration of either. And we've gotten estimates anywhere between $9,000 and $35,000 per job. So it's hard to get there to sort of understand. And the Water and Sewer Authority charges about $6,500 for the hookup in addition to whatever the contract work is. And so, so I think we don't know until we get better sense of where those things are. And obviously, if we do this sort of clustering, it'll be cheaper per household in a particular cluster. Apparently newer construction, the Water and Sewer Authority has been creating an actual physical hookup at each property, even if they're on septic. And so that might make the process somewhat easier for us, but I'm learning more about septic and sewer than I ever thought I would.
Anyone else?
I just have a quick question. As far as like the foster care, how do you handle if you have a family that has like in excess of 1 and 2 siblings? Do you try to keep them all together, or do you ever come across that where it's difficult to have them go to the same place, so to speak, so they won't be separated?
But certainly, sorry, go ahead, Alice. I was going to say it's a best practice to keep families together, but I'll let Alice talk about the specific challenges around that.
Yeah, I would just say the very same. It's certainly our desire to try to keep children together, but it's very constrained by the availability of the foster placement, and it then also the level of need of the children. Sometimes a child's level of need can be so exceptionally high that they can't stay with their sibling group. But so all those factors play in. And the other thing I would add in that's also foundational in our practice is wherever possible, when we're anticipating a child entering foster care, we are exhaustive in our effort to locate a family member who would either first assume custody directly or secondly be approved as a kinship foster placement, because that's certainly our preference wherever we can find such, to have children remain connected to their families and culture. It's unfortunately, though, the reality is that there are a significant number of kids who either have no family in the state of Virginia, and our foster care policy doesn't allow us to look out of state for initial placement. And then there are some also situations where family members have been exhausted by trying to help. So we might have family members in the area, but they're at a point where they can't be considered for placement.
So did I understand you to say that if there is a family member that lives out of state per se, there's limitations where you can place them with families?
Yes, yes, ma'am. There's a pretty complicated process, interstate process called ICPC, and we do utilize that when we have viable family members that a child could go with, but it's pretty lengthy and complicated process that takes months. So when a child first enters care, then if we don't have the local placement or local family, then we can't place out of state because we have to go through ICPC, and that's a slow process.
I have one more question about preschool. If we can switch gears, I don't want to cut the conversation short. Okay. So I saw on the news that Albemarle County had like 40 open seats in preschool. Was that the Bright Stars program, or is that a separate ACPS program? And are we filling those seats? And why do you think those seats were open, and all the information?
Well, I'm very excited to provide the update that as of Monday, and it could be even different today, but we were down to 9 vacancies, 3 in one school and 6 in another. So our Bright Stars coordinators, I think, have worked exceptionally hard to try to promote and get in the news that we have these openings and work with people to get signed up, and they've spent time on their weekend at community events, and they've really gone the extra mile to try to get children enrolled and have been successful in their efforts. So we're pretty excited about that. I don't know that there's anyone knows for sure the why of this year and the delay with getting kids enrolled. One theory is we have switched over to a common enrollment process called Go to Grow, and it's all online, and it's a really complicated application. And so if you're not having access to internet, if English isn't your first language and you're trying to navigate through all of that, I think it can be challenging. So there's some theory that maybe that contributed, but we don't have the data. We're not sure.
Well, it sounds like the team did an amazing job filling those seats. That's wonderful. Thank you.
So I don't know if anyone else has a question. You can certainly think about that. There was one that I made a mark about. It was in the Office of Housing News, which is number 4 and letter F. It's about the staff is developing a waiting list for affordable units provided through developer proffers or future accessory dwelling units. And then it says, initially the waiting list will be open to county police, fire and rescue, schools, and local government staff. I've never heard of that. So they're saying the waiting list for the housing, to live in the housing, is going to only be open to those county employees?
It will be a pilot. So we'll pilot with county staff. So these units don't exist yet. So this is all really theoretical and prospective. And so Stacy Pethia has been developing a set of developer incentives to try to improve and incentivize the number of affordable units that developers provide. The opportunity for providing at or above market units is just so huge in this community that the county has to contribute a fair amount to try to convince folks to do that. And so one of the ways to do that is to provide additional density opportunities to build more units per acre than would otherwise be available to you if a percentage of those new units is affordable, and particularly if it's affordable at deeper discounts. And so the second piece of that incentive is for the county to maintain a list of eligible renters for those units. And so the developers say that's really hard for them to then income qualify and go through the process of identifying folks who would meet their fair market or below rental requirement as part of their density agreement. And so they've asked if that's one of the things the county might do. And so initially the county would pilot that by saying, we have a list of people who have access to mainstream vouchers. And so they're already income qualified and they have a source of payment for them. And so that's an easy group of folks to refer people to. And then the next level would be county employees who meet income qualifications as a perk for county employees to be able to find and access affordable housing in the county in which they work. And so if we can, that would then be a pilot for how we would set up a system that might include a larger group of folks. So that's one of the things that she's working on. The other is encouraging use of the Affordable Housing Fund to help provide down payment and rental assistance for county employees. That is still very much in the theoretical and sort of birthing moment as opposed to something that's approved internally. So I mention it only because it's possible.
Well, I mean, I'm a county employee, so I have a biased opinion. But I wasn't sure if this was saying that this is putting county employees in front of the people that are already on a waiting list.
No, this would be for new units that are as yet to be developed. And so there would be essentially what you're identifying. So there'd be multiple kinds of waiting lists. And so most affordable housing waiting lists we have are at 50% or below area median income. So deep sort of federal subsidies for housing. These affordable housing units would be closer to what we call workforce housing, somewhere between 60 and maybe 90% of area median income. And so folks that don't qualify for the subsidy from the feds and folks who can't afford the traditional fair market rent. And folks who frankly are working in, local government and schools. And so it allows for us to sort of check two boxes.
Maybe the solution is our local government should pay people enough to live in the community where they live. I'm just saying, I'll write a letter to my supervisor and suggest that. Does anyone else have questions, comments? I know we went a little bit over time. All right. Thank you. And we can move into your presentation.
So one of the things I've been thinking about sharing with you all is all of the ways in which DSS employees are working on community problems and community solutions on teams and coalitions and boards that we don't talk about. We talk mostly about the product, the work product, what we're delivering in terms of our mandate, but we don't talk about all these other ways in which we're sort of working on quality improvement or policy change, or even sort of just cooperative collaborations that we are all involved in. And it's a lot. And so I was interested in finding out about that and sharing it because I think it's an important part of our work, but also because prior to my working for the county, there was a persistent narrative that the county wasn't, quote, at the table. And so I was curious about where that came from. And when hopefully you looked at the list that was attached to your information items, you'll see that we're at a lot of tables. And so part of it is pushing back on my own inherited narrative, because we are at a lot of those tables, and to share that with you. And so I've asked Alice and Marion, and I will share some details around some of those. We're happy, of course, to answer questions about any of the ones on the list, but just to share a couple of details about a selection of those groups. And so Alice has the biggest batch. And Alice, I wonder if you'll save the Resilience Alliance to the last because of your comments about internal versus external. Most of what you're going to hear about today is externally focused. And so we're out in the community working with other community partners on stuff. And so I think Alice, on your list is Yancey Community Group, the Human Trafficking Task Force. Yes?
Yes.
Okay, awesome.
The Yancey Community Group and Food Bank was started about 8 years ago when our social worker extraordinaire Renee Lundgren was out at Yancey and developed a relationship with the Food Lion and arranged to pick up food during the week that the store couldn't sell any longer, and the food was distributed to Club Yancey's kids and families. And then when that school year came to an end, Renee met with Albemarle County Public School folks, as well as the Blue Ridge Food Bank, to see how we could continue this important project for the community. Other community folks were invited to join in and think about it, and that kind of was the genesis and gave birth to the Yancey Community Group and Food Bank. So at this point in time, Renee's involvement is significantly scaled back, and other people are really in the leadership roles. And particularly Berlinda Meals and it's a dedicated group of seniors that meet twice a month. And they set up and give out the food. It's a lot of work. They now have their own van to pick up food. And the pantry serves anyone, but they're pretty focused on families in Esmont, Schuyler, and Scottsville community. And the pantry's open twice a month, but if need arises, they can get food to whoever might need it, and they deliver. So from those kind of humble beginnings, it really grew. And the Human Trafficking Task Force is designed to help juvenile and adult victims of human trafficking by making sure there's a team in place to coordinate an effective response to a report of human trafficking. I think you all had attached our agreements and protocols with the Human Traffic Force, so that gave you a good idea of what they do. It's kind of I would say threefold mission. One, to coordinate our service delivery so that in our various roles, whether law enforcement, medical, social services, or other community providers, you encounter someone you suspect of being involved in human trafficking, A, you know what to do, and we've agreed and have a coordinated response amongst ourselves. B, the education piece of the different partners is important, because I might be in a social working role helping, but I might not know what the law enforcement protocol is. So by coming together, everybody has this common knowledge base and knows how to proceed. And then thirdly, the group also focuses on community awareness. So that not too long ago, NBC 29 did a feature on them, because they're part of what they want to do is raise awareness and in an order to better serve and identify folks who might be victims of human trafficking. So that's the elevator pitch on those two groups.
Thank you. Mary, will you talk about the prisoner reentry?
Sure. So the Charlottesville Albemarle Reentry Council is a group of, it's made up of local human service agencies, folks from the jail, from probation, OAR, and then other agencies. And the mission of the group is to create lasting solutions and opportunities for people returning from prisons and jails, so that they thrive in our community. And so that's the whole point of the group. And so right now, there are several, I'm on the steering committee, the advisory, we changed the name, advisory board now. And there's several committees. Currently, I think the biggest subcommittee working right now is the One Stop Center. That is in its sort of pilot phase that was put into place because there was, because there was going to be larger numbers of folks entering into the community that had been in jail for years because of the rules and regulations that had changed that reduced their sentence time. And so there was going to be an influx into communities across Virginia. So we worked to build this one stop so that folks, when they're coming out of prisons, there would be folks there that could help them get attached to jobs, housing, sign up for benefits, and those types of things. So that is going on now. I think it's monthly right now. It's just like a monthly pop-up thing at the moment to sort of, as we transition into figuring out how to do something like that long term. But that's the goal of the program or of the council. And so that's just that subcommittee, and is an example of what we do, the community coming together to help folks be successful once they leave prison.
Mary and I both also serve on the Community Mental Health and Wellness Coalition, which is focused on providing coordinated care, improving integrated care in both our hospital settings, and improving access. And so over the last several years, the issue of access has been defined as defined more sort of strategically around essentially providing access for Black and Brown folks in our community who have a history of well-reasoned and well-founded mistrust of the systems of care around mental health. And so as a result is doing a fair amount of work around cultural sensitivity, racial sensitivity and awareness, and working towards some equity goals. The coalition also has been instrumental in the creation of the mental health goals around the MAP process. And I'm just trying to remember what all those letters stand for. I think of mobilizing action around policy and practice, or I don't know what it is. But anyway, MAP is every 3 years, the local hospitals and communities have to do an organizational process where they identify gaps and needs and then identify health improvement programs for both the hospitals. It's required under the ACA and prior to that, I believe as well. And it really does have a strong, there's an opportunity for strong community voice in hospital operations, which is a pretty exciting opportunity. And so the coalition provides the mental health component of the MAP action plan. So and so we're both involved in that. And then I wanted to share with you information about the Virginia Eviction Reduction Program, VERP, which we like saying. And Philip Holbrook and Sam Spencer both serve on the advisory board for VERP. And VERP is a collaborative effort of community providers, local government that came together around the prediction that there would be a wave of evictions after the subsidies that were part of the CARES Act and the ARPA Act started to go away, that there would be this sort of surge of evictions. Something like 84% of people are unrepresented in eviction court, and unrepresented folks generally are almost always found guilty. And so the favor is with the landlord. So representation really matters in that courtroom. And so this collective got together and applied for some funding from the Department of Housing and Community Development. This grant is administered by the Thomas Jefferson Planning District Commission with the intent of having some regional impact. And they decided they were awarded a portion of a grant that they decided to use to invest in the Financial Opportunity Center. And I'm not sure if you're aware of the Financial Opportunity Center. It was started by Piedmont Housing Alliance and others as an opportunity for folks to go to one place to get financial education, to address credit issues, to address evictions, to address a bunch of things, which is kind of amazing, as most social workers have some information and knowledge around about finances, but we're not experts. And so this is a great opportunity for folks to go to one place and get lots of critical financial information. And so the VERP grant is funding housing navigation and support at the Financial Opportunity Center. But it's an exciting opportunity for us to be involved in broader conversations around keeping people housed. And then I serve as the county's representative on the evidence-based decision-making team, which sounds like it covers everything in the universe, but really is focused on criminal justice. And so the evidence-based decision-making team is focused on improving collaboration, coordination, and data-based decisions in the adult criminal justice system, from law enforcement to court involvement to jail operations and to Department of Corrections. And we're all at the table. And I'm always amazed by the spirit of collaboration in that room. There are lots of rules and requirements that are hard to come by to change, but there's lots of folks in that room who are really interested in trying to improve the outcomes and well-being for folks involved in the adult criminal justice system. And finally, the Blue Ridge Area Coalition for the Homeless. I serve on that board, as does Sam Spencer. The Blue Ridge Area Coalition for the Homeless used to be called the Thomas Jefferson Area Coalition for the Homeless, but like very many have changed their name. And its primary goal is to implement the community plan to end homelessness. And so it serves as the grant receiving organization that then distributes to local agencies from the Virginia Department of Housing and Community Development, Albemarle County, the city of Charlottesville, and HUD. So there's a fair amount of money coming in for homelessness, and they have been the sort of coordinating and driving force behind the creation of Premier Circle and around the hotel stays for people experiencing homelessness in the pandemic, which has been extraordinary. I don't think anybody predicted at the beginning of the pandemic that there would be either money or will to house most of those folks inside for 2 years. And then finally, this is an internal effort, but I think worth some conversation and for you all to hear about, which is called the Resilience Alliance, which I'll ask Alice to talk about.
The Resilience Alliance is one I'm pretty excited about because we've really had some good, we feel like good results. A few years ago, some of our staff attended the National Family Engagement Conference out in San Diego. And while they were there, they learned about an evidence-based model for that is designed to mitigate secondary trauma and symptoms experienced by child welfare staff and secondary trauma's impact on unit and agency functioning. This curriculum was developed by ACDSS NYU Children's Trauma Institute in New York City. The training manual and the curriculum for participants is provided at no cost. And it totally spells out what it is. And basically it's an intervention that has a strong focus on how the secondary trauma influences organizational cohesion and functioning. And to really be effective, it requires participation at all levels of staff, including leadership. And the curriculum has tools in it that help child welfare staff identify and better understand and address how the work in child welfare affects them, so that it really equips workers to hopefully more effectively manage the stress and secondary trauma that they and sometimes direct trauma that they experience on a regular basis. We started out with a pilot. The facilitators were the 4 staff members who had attended the national training, or 3 staff members, excuse me. And the pilot, when we did the pre and post surveys, staff were really enthusiastic about it. So we're in the middle right now of another round where there's 2 different groups that each have approximately 12 to 15 child welfare staff in it, and being facilitated by some of the participants in the pilot group. They're a little over halfway through. And we think it's so important. And for those who are facilitating, it really is a above and beyond time commitment to prep for those sessions. And so to honor that extra effort on behalf of their teammates, we were able to provide kind of small stipends to folks for providing the leadership. So the child welfare supervisors team will be also engaging in this in the upcoming months, because we think it's important. Part of supporting our staff is ensuring that all the SUPs have the same tools in their toolbox so they can support the staff. That's going to be coming up in a couple of months. And ideally, when our full vision is realized, I would say with respect to child welfare, we certainly want every staff member to have done it. And Wanda and I have had some limited conversations here or there about would that be something that our benefit staff would also be interested in, because the evidence and the research that they've done on it, that there are organizations where they do it across the board, and across the board they saw improved retention and longer staff stays. So we're hoping eventually to have a similar outcome as our staff get equipped.
Thank you. That's just a sample of the sort of coordinating, organizing, collaborating work that DSS staff are involved in. Happy to have questions.
I have one, if that's okay. Can you tell me about the Brownsville Elementary School treatment team, and if there's something special about Brownsville, or if all schools have something similar, or how that works?
I don't know anything about that. I think that's, I can't remember who listed that. Mary or Alice, do you remember?
I don't. I would imagine it was one of our school-based staff, either from probably family support program. I would need to follow up with them and to see what specifically that is. Some of schools definitely have their own ways of how they organize around identifying at-risk students who might need extra support. You know, both academically, there's a well laid out process, and then beyond that, I think that's where you get like things like the treatment team, if there seem to be other things going on. But I can follow up and we can get that information to you.
No need, really. I was just curious as to why that elementary school was specifically mentioned.
We did ask that everybody identify all the ways in which they're involved. And so some staff may have identified that as being something that they should include, and others may have identified that as something in the natural course of their jobs. So,
I was wondering, you know, when I looked at the list, it was amazing, the work you're doing in the community. I was just really stunned and very appreciative. And it got me to thinking, you know, you were talking today about redoing all the job descriptions. Are staff members required to be a part of these, you know? Is it part of their job description? Are they stepping up to participate in these different groups because they're passionate about it and they feel like it will make a difference? I'm just wondering, because when I look at it, I think that's a significant number of work hours that's committed to our community in a different way than I imagine from their day in, day out jobs. So I'm just wondering how that fits into the broader picture for both the department and the individual.
As I say, some of those community engagements are a natural course of their job. So whoever would be in it, we would expect them to be part of treatment teams and those kinds of things. For the most part, people are stepping up, as you suggested, to solve a problem that particularly annoys them or they're passionate about. It's very rare that somebody's involved in one of these teams or projects because somebody told them to. That it's generally because they've gravitated themselves towards a problem-solving role. There are some roles that I think probably more Mary and are participating in where there's an expectation that someone from the county participate. And so that's, you know, that's a voluntold is a term that gets used at DSS quite a lot. And so depending on the day, how you feel about whether you've been asked to attend or whether you've chosen that for yourself. But certainly we would, and there are also people who say, you know, it's a professional growth and development opportunity for them. And sometimes, you know, I'm a really big proponent of this, that any opportunity, even walking around in the parking lot for 5 minutes, but particularly one of these sort of coordinating sort of processes or collaborations allows you to get out of the weeds for just a little bit. And that perspective taking can be really important to being able to go back into the weeds to do this kind of work. And so I hope that it feels like that for people who are engaging in it, this opportunity to sort of look upstream and change a problem or change the way we solve it internally. But so, yes, yes, and no, maybe to answer your question.
It just seems like really good information to get out as well for the department, because it really does show how interwoven you are in the community and the work that you're doing and your collaboration beyond just your day in, day out work. I think it's a wonderful list, and it's information that we should probably get to the Board of Supervisors, and I think just as information for the community at large.
Thank you for that. I will say a growth opportunity for the Department of Social Services is marketing. Because we generally are in one spot, people are coming to us asking for something. We don't do a lot of, like, Mary and I had this conversation after the storm work that was done in January. And the social services team had a pretty heavy lift to respond to the storm, staffing shelters and sort of shifting around their works so that they could be available for people who needed showers or just to be out of the cold. And when the pictures went out, there were pictures of guys standing next to snow machines having pushed snow around, or people who had moved trees out of the way, or police officers who responded to somebody who was stuck. But there's not a lot of pictures of social workers staffing a shelter. So it's one of the things that I don't think people think of. And it is one of the ways that we would like to have people understand the quality of our work differently. And so I'm not saying that flippantly. We really do need to think about how we tell our story in the community in a different way so people understand it. Because there are times in which we feel very teenager-like and misunderstood, you know?
Yeah, and I see that as a larger part of the movement that you were talking about last time, I think, about moving to a human services model. Because I think oftentimes members of the community might think that social services doesn't apply necessarily to them or have an impact on them. But I think when you look at that list and you look at the broad base of things you do as a department, there's not anybody in this community that's not affected by it. But I don't think a lot of people know that. And so.
Yes. Yeah, agree.
I'm glad that you brought that up, Natalie, because I had made a big giant star in my paper, like, this list is huge. It is really impressive, all of the different things that you all are involved in. But another thing that sticks out to me is, in particular, when Alice was talking about the Resilience Alliance, just how reflective this department is, and how it seems like you are always like doing some examination of what you're doing and why you're doing it and how you can try to do it better. And in particular, there was an information, I can't remember if it was in August or July, but there was a book, the word dysfunction, 5 something. And that's in it. And I want to look that book up, just because it's amazing that people in this office are going to be having that kind of a conversation and examination of yourselves and your practices and your actions and your words and how they're affecting other people and how you can change to do better. So I think that there's a lot to be said for being willing to do that work inside of the department, because it's kind of admitting that there's always room for improvement, which we know is true, but there are plenty of other departments, not just in this county, in the whole world, where people are saying, no, we're doing just fine. So we really don't need to change anything. Your complaints are completely invalid. So I just wanted to mention that I've noticed that not just in this meeting and not just in these information items, but in the past as well. And I think that that's something that's really impressive.
I do think that's one of the powers of starting with social work as our foundation, is that it requires us to be self-aware and to be self-examining. And so we get to ask our staff to do that kind of self-examination with a stronger foundation than maybe other departments start with. I'm always amazed, actually, that sort of self-examination and self-awareness isn't part of a skill set that other folks in other worlds have. I like that very much about social work. It allows us a chance to be fallible and vulnerable too, which is nice.
Actually, I was wondering from our last meeting, sorry, I'm trying to find my notes here. You know how you had said it's the human services, the navigators, is there any update about how you are, how are things going with your kind of research about that?
Well, I mean, we certainly have already identified a lot of need, particularly if we think about navigators as a way to improve access to what we already provide. We know that we're losing people who start at the door but don't actually get to the service. And most obvious of that is housing, but it's true in lots of units. The strategic planning process for the Board of Supervisors is about to launch. I think our first session is on the 24th or something like that. Our response to that around human services expansion or human services sort of adoption, however that looks like, will be informed by their goals. And when we get to the message out, one of them will be my encouraging you all to prime the board for thinking about human services outcomes. And by that, I mean general health and safety of the community. That's not just in our wheelhouse, it's also in public safety and in fire rescue and in community resilience and a bunch of other things. But the Board of Supervisors hasn't, in past strategic plans, identified specific human services goals for the county. They've been primarily land use focused. And so being able to call out some of these things will help us in terms of thinking about what our mandate is, and then also help us figure out what specific objectives we should be talking about. The Department of Finance and Budget in a recent meeting last week identified some concerns about thinking about this fiscal year 24 planning, which would affect some of that work, not all of it, but some of it, which is that we've had 2 years, we had a year of skinnying down. Everybody had to sort of get tight. And then we had 2 years where we actually had, I think the county had like over $40 million in federal funds that came in through CARES and ARPA. And so some of that went to support, COVID related operations or COVID related adjacent operations. And some of it went into the community. And now we do not anticipate getting that kind of influx. And so there's some expectations management around the budget this year, saying we have to go into it assuming that we're not going to have extra money from outside. And so that made me rethink some of how we might approach it. I think there's lots of time between now and when we submit a budget for us to know more, but it made me think about that. I also want to say that, we talked, there's been a lot of conversation about sort of how we incorporate human services goals into the work we do. And I do think it's a really important perspective. I think that's why the county hired me. And I think that Albemarle County DSS is such a strong brand, both in the community and internally, that any change to that branding will feel bad. And that's not something I'm interested in doing. And so it just makes me think sort of more strategically or maybe more plottingly about how we get to that spot. So anyway, it's not that we're not going to try to do it, and we can certainly provide housing, housing or human services navigators without changing any names or talk about ourselves differently. So separating those issues out is probably wise. Anyway, just more thinking that I've done since last time.
Anyone else have any questions or comments?
This is actually related to earlier. I meant to ask, so did I read right that anybody that applies for emergency Medicaid is then automatically put on Medicaid? Is that what's happening?
Wanda's shaking her head.
Great idea, but.
There was a change for emergency Medicaid recently that very watered down version would be your statement is accurate. However, as with all eligibility, there are exceptions to the rule. And so the policy can be 1 inch thick, the exceptions to the rule could be 4 inches thick. So what recently changed is, in order to get emergency Medicaid, there had to be an emergent medical need. So somebody showing up in the emergency room or delivering a baby or something that the hospital staff doesn't plan and schedule you to come in and do. So if it's have a baby, you go when you go, right? And that's emergent. Well, it used to be that we had to send all of the medical records after the event ended to Richmond and have Richmond have nurses or whoever they had on their staff confirm that it is indeed emergent. And then they would send that back to the caseworker who could then process the Medicaid case. So that they had to be discharged first. So all of that happened. So somebody that's in the hospital and needing a lot of life-saving events, a car wreck accident or something like that, they're waiting on Medicaid and Medicaid's waiting on discharge, and you know, it just became this thing. So there was concern that people without means were not getting treated appropriately. And so they've eliminated that whole department to certify that things are emergent. So now, if they're admitted in the hospital or admitted through the emergency room, we approve them. They hold it up on whether they pay it or not.
Oh.
Okay, so they're approved. They go forward, they do what they're doing. Then the hospital tries to get billing, and that's when it's evaluated to determine that it meets these emergent category.
Okay. And then if it does, they qualify for continuing. Okay.
Well, they qualify for Medicaid regardless,
Okay.
but whether Medicaid will pay or not, emergency services Medicaid only pays if it's emergent.
Okay.
But they're approved for that category of Medicaid. And then if you have an emergency need over the next year for anything, they will then pay it.
Okay. Thank you.
It really does help the workers a lot.
Yeah.
We don't have to
I'm
get
sure.
weighted in that whole delay thing.
Yeah, I'm sure. By the way, what happened with the Medicaid waivers and all of the work of recertifying people to qualify? Is that happening yet?
No.
Oh, okay.
They put us on a pause now until at least October. We should have heard something either today or tomorrow if they're going to start it. I think it's actually, it may have been yesterday even, but I think that it's postponed until at least January probably, but there's even talk that it won't even happen then.
Wow.
So we just don't know how much longer they're going to keep pushing this back. It's really hard because we start feeling like, okay, they're really going to do it. So we need to ramp up. We need to be ready. And then it's like, no, we're not going to do it. Just kidding. So we pause. And as soon as everybody comes to pause, they start ramping it up again. And not just kidding, not this time either. So they're supposed to give us at least 60 to 90-day notice. So we're just hands down until we get that.
Right. Thank you.
So if no one else has any other questions or comments, Kaki, did you want to give us a brief description of what you think is going to be coming down the list for our next couple of meetings? Or did you, it's okay if you don't know also.
I don't think I know. I mean, I think certainly there'll be some conversation after the strategic planning process starts that would inform our next probably conversation. And then in October, I would imagine we're probably going to talk some about budget, just in terms of the time frames. But.
Thank you. And we had mentioned
about the meeting.
Yeah,
yes.
The meetings would possibly have to become in person, and that is a September thing.
They do have to become in person, and it would be in September. I will be out of town for our September meeting, just as an FYI. And so Lisa and I have been talking about what rooms we have. The easiest access to our rooms is in the actual DSS part of this building in McIntyre, but they're not considered open to the public when we're there behind a a door, even if we could escort people through a locked door. So there is a room that probably would be big enough for us. Is it C? Is that what it's called? Room C? That's right after you walk through the front door of our building on 5th Street. So that's likely going to be the room we end up using.
Is that the 5th Street location?
Yeah. So that those things are not 100% finalized. There's one more meeting, and I think it's the meeting, their board meeting tomorrow to finalize that. But there's no, I think they were hedging to make their final determination based on any potential change in COVID. And now that CDC COVID guidance has gotten lots more relaxed, I cannot imagine that that's not going to go forward tomorrow.
So that would be the September 20th meeting. You said that you're not here. Did you want to try to reschedule, or did you want to have someone come in your place?
Well, Mary.
You can't replace, but.
Exactly. Thank you for that. But I'm sure Mary can cover the meeting, and we'll do the prep together with the whole team. But I'm gone for slightly more than 2 weeks, so I think it'll be hard to reschedule in September.
We talked about possibly doing a tour of the offices, and I don't know if you would rather do that when you're going to be there, Kaki, but that could be something that we could do since we have so many new members.
That's a great idea. That's a great idea.
And will the in-person time be the same? Or
well, it's interesting that you bring that up, Willie Mae. There's an opportunity for us to rethink the whole shebang. So is there a time that would work better for you all as a team, particularly if it's going to be in person? What does that look like?
I'm open. What time do you all normally get there? Like the office is open?
I mean, I sometimes get into the office at 7:15 and there's people already there. I don't know what they're doing. I always think I'm going to be first, and I walk in, there's already people there. So there's people there from easily, 7 a.m. to 8 p.m. I think every day, just in terms of flex schedules. So and I don't get in that early every day, to be clear.
So mornings, are mornings bad for any of you? Like you would be completely out if we moved it to a morning? I mean, department wise, you probably have a lot of things already going on, or maybe not.
Yeah, I think we could probably, there's a couple of Mondays that Monday mornings wouldn't work for us. But there's a couple of, they're probably, for all of us, isolated, no dates that wouldn't work for us. But once something got on our schedule and stayed on our schedule, we could make room around it probably. Not sure if mornings work for everybody else, but.
How about, Kaki, why don't we do this? How about I email with you and maybe we could create a doodle poll and put a bunch of different options and then just let board members and staff members all weigh in on that. Because I don't want to schedule what is best for the board only to really super inconvenience the staff or vice versa, so, and then if it ends up that we can't come to a consensus, then I guess we just keep it what we have then. But is that okay with everyone else?
Yeah.
Okay.
Yeah.
Cool. So it seems like we're kind of in the business of the board section of the agenda. Do any board members have any business items that you wanted to bring? I know we have a vacancy on the board. Can someone remind me which region, which area?
Scottsville.
And that's Supervisor Price, is that right?
Mm-hmm.
Yes.
Right. Okay. So one thing I wanted to mention, I did make a note about the meeting, but we already talked about that, was that there was just a job fair, and there are often like activities and things that happen, especially now being the beginning of the school year. There could be some things going on with Bright Stars, but I would love the chance to just as a board do one activity that's not a meeting, whether it's a service project or showing up to volunteer at a Bright Stars event or something, just as board members to be visible and in the community, spend 2 hours, but also just get to know each other, because we can't really get to know each other in these little squares. And truly, when our meetings are in person, we really won't get much time to talk and get to know each other just as people. So if you guys are open or interested to doing that, I would love to try to keep our ears open and eyes open to something going on, some event in the DSS world in the next few months where we could say we as a board want to do that with them. What do you all think about that?
Yeah, actually, I saw December 9th, there's that housing. I don't know if that's what you're kind of saying, Mary. I know what you're saying, or I think I do, which is like trying to understand what each department or any department is really doing by attending something. So if that's what you mean, I saw December 9th, there's a housing. I put it in my calendar because I thought maybe that could be, and that's a real issue that, the area, we're really struggling with. So maybe that's something that we could, if not every board member, maybe some of us could attend and hear if that's appropriate. Kaki, I don't even know if that seems appropriate to you.
I think what we can do is ask staff to let us know about some of these events. I think we'd like to think we know all of the things that are going on, but we don't. And so we could ask, if there's an event that's going on that you think an advisory board member would learn something about the work we provide, or there's an opportunity for you to get to know a board member, just let us know what they are, and then we can include them, or Lisa can send them out to you guys, and then you can let us know if you want to go to one.
And also to be helpful, because I've been to plenty of events where there are board members standing around watching, and that's not helpful, and it's just like vultures. So I would rather come to something where we can actually be involved and be interacting with people rather than just like standing around and watching.
Yeah, agreed. Lisa, were you? Yeah.
Yeah, in the past, several years ago, a lot of our board members went to the Bright Stars classrooms and shadowed the classroom, hung out with the kids and stuff. And that was very popular, but it's been several years ago. And they tried to divide it up so you were in the school that was in your magisterial district.
That's a good idea.
I don't know if they've come back or not, but they also, at least historically, have done family nights, like events, like where they serve dinner and then they have a show, or they do some sort of, they might do some sort of family education, parent education, something, those types of things as well. So if during the day doesn't work for some reason, I assume they're doing family events again. I'm assuming that they didn't do them during COVID, but so I don't know if they're back yet, but those are always, I used to be a Bright Stars worker, and as a Bright Stars worker, you need help to get those to run successfully, whether it be handing out food or, wrangling kids or whatever it is. So anyway, that's also Bright Stars, but another idea.
Yeah, that sounds kind of like the thing that we're looking for. So if we hear or get info about anything like that, then that would be great.
Sure, I can put it on Carol Fox's radar. She's the program manager, so we can, I'm sure, get something together.
Thank you. Does anyone else have any other business you want to talk about with us? So then we just need to talk about what the message out is. And I know that we definitely want that giant list of things that your members from your department are involved in, community. I don't even know how to describe it. These are not groups and they're not boards, but they're like organizations. Oh, there's your dog. What's your dog's name, Kaki?
That's Peter Fennick.
Peter Fennick. Wow.
He's very serious.
Anyone else have things you want to make sure are included in our message out?
one of the things that was included in your packet was a really amazing graphic that Stacy Pethia put together that identified the some plus $1 million in investments in affordable housing made by the board in the last year. And I just think it would be really great to thank them for that. The board hears most frequently that they don't do anything for housing. And so she developed that graphic for them so they could say that's not true. But it would be great to thank them for that investment and to encourage them to feel buoyed by that. And then to the extent that there's some conversation around the strategic planning goals, thinking about sort of reminding them to include some human well-being goals. I think that probably talking about it in terms of well-being is probably the right way to approach it. That will include almost every piece of work we do and community safety, public safety departments do. So that will make a big difference for us.
Sounds great. So you then you're going to condense that and send it out to us, Kaki, is that right?
Which?
Just the message out.
Oh, yes, I will. I was like, oh no, what did I agree to? I forgot already. Yes, absolutely. Yes, I will. I will do that.
Okay. Actually, if I can, I just want to clarify, Kaki. I totally agree putting like well-being and community well-being in the strategic plan. I know we didn't talk about what that would say. Or maybe we did during this meeting, but I'm just wondering where that would be coming from. Is there?
I think there's they're going to be looking at huge amounts of data for their strategic plan. We have primed them and prepped them with some background to say, here's some things we recommend, and here's why we think it's the right idea right now. Here's some data to back it up, those kinds of things. So they're going to be looking at a whole bunch of data that will hopefully lead them to this conclusion as well. But if you think about, most of them are elected by they're elected and hear from community members around land use concerns. Too much development, not enough development, not right here, all of those things. So they hear about that way more than they hear, be worried about people in poverty. Or, we should include making sure that we have a baseline expectation for well-being and responsiveness for our community services, those kinds of things. And so I think even if all you're suggesting is to include human well-being in their strategic planning conversations, they'll have enough data to be able to back that up and to think about that. Unless what you're hoping for is some specific kind of goal to suggest. And we certainly in staff, because this is the primary, if you think about like the separations for their role is that strategic policy making. And so we don't want to get too much in their face with some suggestions, so you guys are in a different spot than we would be as staff though.
Yeah, because I was thinking about when I attended some of those sessions I don't remember exactly, sorry, how they all just come together eventually, but people talked about it in terms of like well-being with Parks and Rec, that's kind of the way I've only heard it really described is like access to trails or access to nature, or parks. Anyway, I'm just trying to think of what the well-being, I don't think that's where we're going with that. It would be more, I don't know. I guess that's what I'm just.
Yeah, I'll do some thinking about it, Amy, and sort of refine or provide some additional words in the message out that I remember to condense and send out. There is something around that the police department, the fire department, and I got together and talked about having sufficient level of community services that we can be responsive and complete in our response, and so that we're actually able to solve people's needs. And so that moves beyond the mandated programs. We talked a little bit about also investing in activities that prevent people's need for deep end, expensive, not very good for human systems, those kinds of things. And so that might get to more of what you're talking about.
Okay, thank you. Yeah.
Early on in the meeting, we had talked about also maybe floating the idea of, I think you referred to them as like flexible payroll tools or something to try to recruit and retain. So would we want to include that in the message out as well?
Absolutely. Thank you.
All right, so seems like that's about it. We, let's just say we're gonna hold for our next meeting temporarily September 20th in the same time. And then if we happen to come to an agreement about a different time before then our next meeting won't be September 20th. But as of right now, we'll just keep moving forward with the date and the time that we normally have until we decide otherwise, because we're in charge.
And we'll think through like having a tour during that, whenever that is, then we'll think through that.
Got it. Well, thank you so much. It was a really informative meeting. Alice, were you going to say something?
Just if you do the tour, I apologize in advance for my office. We've been cleaning out our vault, and we're waiting for the county attorney to approve us getting rid of files, and I have quite the pile of boxes and things in my office these days.
That's understood. Yeah, maybe that door will just mysteriously not open that day and we can't go in there and we won't see your office. But if we do, I understand, because I have boxes all over this room. I just moved classrooms. It was great to see you all. Thank you so much for a great meeting, and we will see you on September 20th. Our meeting's adjourned.
Okay.
Thank
Bye,
you.
Everyone. Good evening.
Bye.